and welcome back to another episode of the A to Z of the NHS. We're working through ears today, and we're going to do the ear. He says, trying to move it around ever so slightly. So we're going to discuss some of the things that tend to come through my door when it comes to ears, we'll stick with our three-phase structure here. So what are we looking
Okay,
at
so
here?
the three phases, viewers, as you know from the previous videos, are ears, fact or fiction, ears, dispel the myth, and ears, what do doctors not tell you?
So fact or fiction, can you actually clean out your ears at home? You know, with a cotton wool bud or stuff like that. I think you can see from the look on my face, you know where we're going to go with that. So we're going to dispel a myth that you need antibiotics as soon as you can for your ear infection, and something that your doctor doesn't tell you. Ear infections can be much more significant than you think and can potentially kill you.
That's a bit worrying, viewers. I must admit, ears are not my big subject.
Really, they're quite sizable.
Sizable in some people. James. What do I know about ears? I know that elephants have big ears. I know that the African elephant has bigger ears than the Indian elephant. But I must admit, I don't know much in terms of the ear, fact or fiction. So over to you, James. Tell us a fact about the ear in a human and not an elephant.
Okay, well actually let's kind of flip what you've just said round. We could argue that what you just said about the African and Indian elephants is wrong, because what we're talking about there with the larger and the smaller one is not their ear, it's their pinna, because the ear is actually the organ inside the skull that allows us to hear, whereas the pinna is actually merely a funnel, a very funky looking funnel, but all of this is designed to take the sound and send it into our ear so that we can hear.
Is that why Vulcans have a pointy bit at the top of their ear? Because it doesn't really matter because it's just a funnel.
Unfortunately, I know the answer to this. No, the Vulcans simply have a pointy bit on the top of their ears because it didn't cost an awful lot to do that makeup.
I see.
And it was an easy way of saying this is a different species.
I see, but what about Romulans and Klingons and their ears?
Well, the Romulan is just a Vulcan who is in touch with his anger, and a Klingon in the original series, again because of budget constraints, that was just a palette change. So returning to our Spockian protuberance on the side of the head, now, I think from a physics perspective, the pinna is this amazing thing. I mean, just look how it's evolved to funnel sound into us. Now, your career as a rugby, did you play prop?
I was a prop, yeah, a tight head.
Okay. You say you don't know much about the ears, but what was the thing that you guys had to be very careful of with regard to your ears in rugby?
That's true, actually. We did protect our ears, and it was conventional to either tape up your ears, usually with black insulating tape because it was cheap, or even wear a scrum cap to protect your ears.
But why is rugby an issue for ears?
It's an issue because in the scrum, that's the bit when all these mad blokes come together and form a grouping at various points in the game, and they duck their heads down. The side of the head comes into contact with your opponent's side of their head, and as the ears rub against each other, they can become irritated and eventually bleed and eventually enlarge and become so-called cauliflower ears.
Absolutely, and that injury that causes a hematoma in the ear, and it's the same thing that goes on with the nose injury. So that blood inside the ear causes destruction of the cartilage. We end up with that misshapen, that cauliflower ear, disrupting the shape of the pinna, meaning the funnel doesn't work as well. And that's the same thing we'll get if we have a broken nose. If there's a septal hematoma, that blood clot on the cartilage there, If we don't drain that, the cartilage will be destroyed and we end up with a flattened nose. It's the same thing occurring just in a different body part. And then, years down the line, as we develop presbyacusis, so age-related hearing loss, it's so much worse in somebody that's had the cauliflower ears or has cauliflower ears because the way of getting the sound in the first place is already reduced.
I can vouch for that, viewers, because one of the reasons I've got a rather stupid nasal voice is that in my rugby playing days, people used to punch me. And even though that's difficult to understand...
Oh, it's not.
It is true. And more than once I had my nose broken. And of course, all of these punches were completely unprovoked and it was nothing to do with me. I didn't say anything and I never punched them first. But for whatever reason, I used to get punched and my nose was broken on several occasions, but I never got it looked at, and I'm sure I had hematomas at some point which permanently damaged my nose. So the moral of the tale is...
Don't play rugby.
Correct.
So it is our major bread and butter for GP. And just to reiterate that point, I've brought a prop. Well, actually, I haven't brought a prop, but I brought a story wrapped in a prop.
That's a nice, clever way of bringing in rugby again, isn't it? Prop.
Hadn't thought about that, but this Hein otoscope, okay, Mini Lux, this same one is still used by many GPs across the country. This otoscope that we use to look inside the ear was given to me by my family's GP. So this otoscope has looked after my grandparents, it's looked after my parents, it's looked after me, and now the same thing is still used to look after my patients today. That's how common ear issues are in GP land, that these things get passed down.
Unlike James, I am from a medical family. In fact, I'm the 7th Dr. Steen, so I'm not very original, but I've kept much of my father's equipment from when he was a GP, including a medical bag, which is full of various metal objects that do unspeakable things to humans, but also I sit in his chair, which is an old and very comfortable wooden chair, and this helps me when I'm writing books or websites or whatever to know that I have his brains, which were a lot greater than mine, working on the problem and not just mine.
These medical families, they keep on going, but they still bring in fresh blood at times. But the reason why I bring this out now with regards to the fact versus fiction, can you clean out your own ears? Can you buy stuff online in order to go in there? I would strongly dissuade anybody from. The reason being is the number of times I use this to look inside somebody's ear when they say, "Doc, I can't hear very well, I've got some earwax, I've tried to clean it out, can you have a look?" 9 times out of 10, I put the otoscope in and have a look through the ear canal and find this massive glob of earwax, not cleaned out, but compressed against the eardrum, compressed against the tympanic membrane, meaning that they can't hear properly now, because essentially they've got a bung in it.
So is what you're saying, James, that we should not use a cotton bud or something like that, but use a sharp object to take that gunky stuff out of our ears?
The only thing that you should put in your ear is your elbow. If you can get that in there, good luck. Other than that, do not put anything your doctor has not given you in your ear. I hope that is crystal clear.
Got it.
Nothing in the ear that you have not been given by your doctor. And this is the point about earwax. People get really, really het up about earwax. To sometimes people almost have it that, it's that, they view it like a haircut. It's that time of the month, I'm going to go and get my ear syringe, get the earwax out. Leave the earwax alone. Earwax is great stuff. Earwax protects the lining of your canal. It protects your tympanic membrane, protects your eardrum, and it's self-cleaning. If you're shoving something into your ear, you could push that earwax further in, meaning we then have to get involved to get it out. You could push it further in and damage the tympanic membrane. You could even damage the canal itself, which can cause infections, which can go into the bone. Okay, don't put anything into your ear other than something we've given you, and leave the earwax alone. The only time that we realistically need to worry about earwax is if it's blocking something like a hearing aid and preventing you from hearing in that perspective, in which case we want to help you with it. Please don't try and do it at home.
And just to expand on that a little, remember that earwax is essentially a bodily fluid, a normal bodily fluid or substance, and in fact there are loads of bodily fluids and substances that we may discuss in further videos, and this was one of the many reasons I started to like James when I met him 10 or more years ago, because he loves discussions on bodily fluids, and that can be tears, snot, saliva, sweat, everything. He loves it all. He loves goo and all of this stuff. So we hope in future videos to get that love we both have across to you all.
I think Andy's relating to the fact I read too much Blood, Bones and Body Bits when I was growing up. But since we've raised this point now, one of the things we're thinking about doing is a video on fluids where we discuss all the mucky, sticky, slimy stuff to do with the human body. But we're not fully there yet at the moment. So we've put a poll on the Communities tab. So pop over there and give us your vote. Would you like us to discuss all the stuff that can come out of a human body in a separate video? Or is that just going to be a little bit too disgusting for you? Anyway, give us a vote and we'll see what we're going to do.
Okay, let's move on to dispelling a myth. So what myth regarding the ear would you like to dispel today, James?
Again, another issue that comes with GP is infections, and people get ear infections very, very regularly. And as a rule of thumb, they're going to very quickly ask for antibiotics. Now, I do fully understand that. Ear infections are painful, for want of a better phrase. And it's one thing to have a sore toe or a swollen knee or whatever, but an infection in the ear, it's part of your head, and it's so very uncomfortable. I understand that patients want help. However, antibiotics are almost certainly not the answer in the vast majority of cases. Most people will be able to clear an ear infection on their own in 5 days without any antibiotics and without any impact at all. Antibiotics in the ear probably aren't going to do much in the short term and may cause some issues. Now, I don't know if this tee-up will work or not, but you really like gentamicin as a renal doctor, don't you?
I wouldn't say that. Gentamicin? Well, what is gentamicin? It's an antibiotic, only given intravenously, therefore only given in hospitals. It comes from a group of antibiotics called aminoglycosides, and yes, it is toxic to the kidneys, and therefore, for myself, as a kidney doctor, in some ways, it's a no-no drug. But, there always is a but. In fact, in various situations, it's the best antibiotic to give in kidney failure, and that's because we can give it once and its effects last for a week. It's only a problem if you keep giving it and you don't measure the levels of gentamicin in the blood. The only other issue, and taking this back to ears with gentamicin, is it can also cause deafness, and in fact the deafness is more serious because the deafness tends to be permanent, whereas the effect on the kidney is usually temporary.
Oh, I'm really disappointed with that. I wasn't expecting a reasoned response like that. I was expecting to say gentamicin and, the equivalent of throwing holy water at you. I was expecting it to burn, the word, but okay. So my disappointment at Andy not combusting on the introduction of the word gentamicin notwithstanding, we use gentamicin eardrops not infrequently, and we're going to put those into the ear and they're going to essentially get to the tympanic membrane here, but we can see the nerves and things just on this side, and gentamicin is toxic to the ear, so it seems to be utterly bizarre that we want to put an antibiotic that can destroy the ear, completely Roger, technical term, the hearing apparatus of the ear into the ear. Now, realistically, penetration through there isn't that strong, and again, the ear, nose and throat team will say that you can get away with using it for about 1 to 2 weeks without any problems. But we need to be very cautious not to use it regularly, because it can hang around here for up to 6 months. So prolonged courses could result in death of the patient's hearing apparatus because we've tried to give them antibiotics. Yes, antibiotics can be needed in some cases, but hopefully you'll see that antibiotics have potentially really significant problems. And if your body is able to deal with the issue in 5 days anyway, hopefully that will be a learning thing to go forwards with. Hopefully patients will be happy to use the paracetamol and ibuprofen at home. Hopefully they're able to deal with the pain and things settle. And if not, around that 3 to 7 day mark, then having a chat to their GP if they're still worried.
James, can you just remind me and the viewers about the different types of ear infection? Because I understand there are ear infections of the outer ear, the middle ear and the inner ear. Is that right?
So we're mainly talking, so we have otitis externa, which is anything from the pinna, the flappy bit, all the way down the canal. And they have otitis media when we're looking at the inner ear, so the tympanic membrane and back this way. Swimmer's ear is the most common form of otitis externa, inflammation of the outside of the ear. It's really painful, it's really annoying, tends to come after holidays, and normally settles with an antimicrobial ear drop, not an antibiotic, which again will spray into the ear. Now, one of the reasons why middle ear infections, otitis media, can be so problematic, which is why we say 5 days things should be okay, but longer than that I want to know. An infection that is not treating, is not resolved, can go into the bone and can also damage the hearing apparatus. So there's risks from the antibiotic if we use those too soon, but there's risks from the infection if we leave it too long. So ultimately, we do want to know what's going on with if you're having ear problems, but expect that we may say, let's wait and see, or maybe take a middle ground, taking a swab from inside the ear and send that off to the lab to grow it to see if there's any specific advice from microbiology. That's often the middle ground.
So James, what are the typical symptoms a patient may get that would lead you to think that they had a middle or inner ear infection, for example?
So pain to the ear is a big one, but we're very bad as humans about knowing where pain comes from. So a lot of ear pain can also be due to dental issues. So I'll always ask a patient who's coming in with ear problems, do they have problems chewing? Because that could be that they've got a tooth problem. It could be that there's a problem with the temporal mandibular joint, which can cause, again, all that pain radiating up. So pain is going to be the start.
And anything else? Do they have fever or deafness or tinnitus or anything else?
So absolutely. So that's when we begin to move towards the more infectious side of things. So temperatures, absolutely. Andy said the word tinnitus, so they may have added noises. That tends to be more of the infection as to the middle ear on the other side of the hearing. So ringing, whooshing, buzzing noises that are new and can be really quite irritating, suggesting that the nerve here is being irritated.
Is that why they get vertigo as well?
Absolutely. Now, the vertigo tends to be more of the viral issues, so labyrinthitis, where these semicircular canals are irritated, and the little hairs in there that tell you essentially which way is up and down, they're affected, so they're overstimulated, hence why people can have things, the feeling of them swirling around themselves.
One thing I'd like to show you, viewers, is this bit of the inner ear, and this bone here is called the stapes, or part of that bone is the stapes, and that is the smallest bone in the body. Did you know that?
I seem to remember that in the grim depths of medical school, but it's definitely one to hold forward.
Yes. I wonder how big it would be in an African elephant. I'm going to have to think about that. Anyway, back to our discussion.
Well, as you said, raising the fact you've got these three bones, the purpose of them is to take the sound from the tympanic membrane and send it through to the middle ear, where that mechanical movement will be converted into electrical signals to allow us to hear. And I think when I was told that at medical school, we've got, something that looks like a trampoline will move, and that movement will go down, a couple of poles that connect to each other, and those poles will make electrical energy, and then that will allow us to hear. Absolutely blew my mind, and thought, how amazing is the human body? But as you said, we've got these three bones, and thus these bones can also be broken or damaged, amazingly. The ENT surgeons can replace them, but I, for example, know one friend who, as a youngster, had a middle ear infection which had antibiotics but didn't have sufficient, and ended up with one of these bones being destroyed. Thus, he isn't able to have the movement of the tympanic membrane transmitted through these bones to his inner ear, and thus he can't hear in that side. He's got a mechanical deafness.
Really, that's quite a concern, isn't it? Tell me a bit more about these common middle ear infections. So you've got your patient, they've had their earache, the fever, the deafness, you've given them antibiotics for a week, and they come back to you, they're not getting better, and they say, oh, this pus is coming out of my ear, doctor. What do you do then?
Well, actually, oddly enough, congratulate them. So pus coming out of the ear is a good thing. Okay. So
really?
if you've got an infection in here and it's trapped on the other side of the tympanic membrane, so it's held in place, it's pressing against the skull, it's going to be really quite painful. Bang! The tympanic membrane bursts, all the gunk rushes out, the pain improves, and it suggests that we're actually going to be seeing a resolution of that infection. Now, we're certainly going to still need to cover them with antibiotics. In that situation, we're going to need to protect them, but actually the tympanic membrane is designed to burst and also heal again afterwards.
So we shouldn't be putting a sharp object in our ears
Absolutely
to
not,
burst
no.
the tympanic membrane to let the pus out.
The only thing you should put in your ear is your elbow, and if you can put that in there, good luck.
I think I've got it now, viewers.
But again, you mentioned that what happens if things get worse. One of the things that my patients sometimes get surprised about is I have a real penchant for tapping the back of their head, and they, well, what's going on here? If we've got a middle ear infection that has gone into the bone, this can become really quite serious, and that probably relates to the thing that the doctor doesn't tell you, that ear infections can kill. If the infection has penetrated down into the bone, it can go into the skull, and we get mastoiditis, so this inflammation, this bogginess to the bone here, and that can be catastrophic. And to reiterate how important these ear infections are, I have a colleague who is still working on a patient at the moment who has had multiple courses of antibiotics for ear infections, and because they've had so many, they've developed a resistance. The antibiotics don't work anymore, and she's had an infection that's gone through the middle ear, into the bones, and has gone round the base of the skull and into her spine. So she's had to have the side of her skull removed to let the pressure out, and has had to have antibiotics, going straight into the arm now. Things are that serious for her.
Well, that's quite a sobering thought, isn't it? I hope that she's going to be okay long term. But you said earlier, James, that an ear infection can kill you. How exactly can an ear infection kill you?
So exactly as we said with that lady. Now, we're very lucky that the doctor there got twitchy and wasn't happy that they'd had another course of antibiotics and this ear infection hadn't improved. And the patient wasn't too fussed because they always got a little bit of benefit from the antibiotics. But that doctor insisted on them having a CT of the head. They had a scan there, even though there was no pain tapping on the skull, so there wasn't a high level of suspicion. They were actually checking to make sure there was nothing else going on. And doing that CT, they found how this abscess, this infection, had tracked down through the skull. If that hadn't been done, that patient could have died.
So presumably the abscess could have spread and even caused meningitis, an infection of the lining of the brain, or even a brain abscess. Is that what you're saying?
Absolutely, yes. And at medical school, we talk about mastoiditis as a red flag. And to be honest, it was amazing that that lady had the level of infection she did without pain when tapping over the mastoid.
So one of the skills a doctor has to have is judging when to use antibiotics, when not to, which one to use, for how long, and how many courses you can give before further investigations are done. And that's one of the things you get about seeing somebody like me or James, the experience with the use of antibiotics. But one of the things we're seeing a lot now in the developed world is antibiotic resistance. That's where doctors are too free and easy with antibiotics, give patients multiple courses, they become resistant to those antibiotics, and then we have problems because we run out of treatments.
And I think that's probably a good place to leave it there, to reiterate that the vast majority of ear infections, your body should be able to fight those off in 5 days without antibiotics. But if you're having problems with an ear infection beyond that, definitely talk to us, talk to your doctors, make sure that we don't need to do anything further for you. Well, I hope that's been useful to you all. Thank you very much again for joining us, and we'll see you in the next one. Oh, and don't forget to vote on the poll as to whether or not you want us to do this fluids video.